included it here because I wanted to show you guys different examples that some abstracts, for the purposes of different conferences, might be longer and some might be shorter. So they included the title, introduction, case presentation, and the conclusion. Sometimes it's okay to not include the discussion as part of the abstract because, excuse me, the discussion comes up with the case report itself. So abstracts, for case report abstracts, introduction, case presentation, and conclusion is sufficient. This next example I wrote myself for purposes of the ASA. As you can tell, it's really short. This was really hard to write because it was a complicated case. This was a case given to me by one of my mentors, and I wasn't there for the case, but he allowed me and gave me the privilege of writing about it. So this was a challenge to write about it because I only had 100 words to work with. First thing you want to mention is to give the reader an overview of what you're exactly going to be talking about in the case report. So for this one, it was a woman that had an untreated left atrial myxoma. She had a cardiac tumor that was untreated and was diagnosed preoperatively as she was doing surgical clearance. That's when they found out. And she was having significant abnormal uterine bleeding. So this was an emergency surgery. So in the abstract, you want to talk about what you're going to talk about in the case report. In the case report, I talked a lot about patient positioning because patient positioning is important. I talked about steep Trendelenburg versus reverse Trendelenburg and how that affects the myxoma. And then you next talk about some of the complications of this specific case. So this complications are mitral valve outflow tract, obstruction, acute functional mitral stenosis, and so on. And then the fatal complications as well. And then the last sentence is usually just we report the case of so and so and so and so and so and discuss this management. All right. So this last example was also written by a Trinity student. This is another excellent abstract. This student also included keywords, which is why I wanted to show you guys today. This is about a rare type of hernia. It's a hernia that accounts for 0.12 to 2% of all hernias. So it is exceedingly rare. So to see this and for a student to see this in person and to be able to write about it is fantastic. This piece of literature was turned into a case report and is on Curious Journal. So this is a published, peer-reviewed piece of publication written by a Trinity student. And this is an abstract that is fantastic because it starts by saying that this is what we're going to talk about. This is how it's diagnosed, or this is the difficulty of diagnosing, but this is how it's generally diagnosed with ultrasound or CT. Once the diagnosis is established, this is how you treat it. 27% of Sheikh-Aden hernias lead to strangulation. Surgery can be done this way or this way. And the last sentence, as usual, is this case report discusses so and so and so and so and so and so. The last sentence is important because you just want to say what you're going to discuss, which is a 47-year-old man with an uncomplicated Sheikh-Aden hernia that was repaired robotically. And that's a perfect abstract. I believe this was around 120 words. And then again, keywords are important because now as a reader, you're looking at the keywords. Okay, Sheikh-Aden hernia, strangulation, robotic surgery, laparoscopic surgery. Great. Now I have kind of the overarching big ideas that you're going to see in the case report. So that's keywords. Stop here. Any questions about writing an abstract? Feel free to unmute yourself, or you can put a question in the chat. We'll take a minute or two to answer questions specifically here, and then we'll move on.
So for the abstract example, like especially for the first one that was more lengthy than the others, are we referring to abstracts that eventually get turned into posters, or just abstracts submitted to journals, like paper publications?
Yeah, good question. It can be either one, because for some journals, they want you to submit an abstract. The abstract is reviewed, and then they will consider the entire case report. Uh, not all journals work that way. For example, I keep saying Curious Journal because Curious Journal is a really it's used by a lot of Trinity students. It's used by a lot of medical students in general because it's low cost and has a good amount of, or has a high rate of acceptance. So Curious Journal wants you to submit the whole thing all at once. However, some journals want you to submit the abstract first, and then they'll consider the rest of the written piece. So that's journals. For conferences, it's always abstract first, and then they'll consider it turning into a poster. Because for conferences, it's not that you're not going to be reading something to them. You're going to be presenting a poster presentation at a conference. So if submitting to abstract for a conference, it's always going to be an abstract. If you're doing it for a journal, it may or may not be an abstract. Does that answer your question?
Yeah, that makes sense. Thank you so much.
All right. Again, I just wanted to include some further reading. So this is a really useful thing written by University of Wisconsin on how to write academic abstracts. I know there's a there's a second thing which I'll add, so you guys can read it later on. Hi, I didn't have opportunity to research in undergrad. Would you recommend working with a professor or mentor starting out? Should I start researching topics on my own and go from there? So typically, as Nicole and Austin will advise, or Austin, would you like to answer this question?
Yeah, I was actually responding to someone regarding the same thing. I would always ask a mentor. I mean, first when I first started out doing with clinicals, I definitely needed help, especially with like how to write case reports and conduct presentations and stuff. And the first thing I thought of is just reaching out to someone who's been there and done that. And I happened to actually come across you, Hussein. And so the first thing I would really advise is to just seek a mentor, whether it's a professor or a fellow student. They will give you much needed and helpful advice to at least get the ball rolling. And that's always the hard part, just getting the ball rolling.
Yep, absolutely, Austin. Yeah, I would definitely agree. Having a preceptor that you trust and value to talk about something you're interested in is a great place to start. Also keep in mind preceptors sometimes have case files that they just don't have time to look at or write about, but are interesting and they are willing to give to students, of course, with patient consent, either verbal or written. And if you receive the case files, you have to Sharpie out or make sure that there's no identifying information on the case files that you receive to avoid HIPAA violations. So definitely working with a professor, preceptor, or a mentor, even a peer mentor, as a mentor that's also a student, a senior student is great. When Austin was started out doing presentations last year, he presented at the GAPI conference. I was fortunate enough to help him kind of get his bearings. So reaching out to a senior student that has done it before is a great place to start. However, I just wanted to add to what Austin said. You can also start looking into topics you're interested on your own. That's completely valid. But like Austin said, as a third year student, as an early clinical student, we don't really know much. So having somebody to rely on and to bounce ideas off of who is more experienced is useful. But of course, you can look into topics and research things on your own. So great question, Mary Angel. Thank you for that. Okay, we will move on to poster presentations. So poster presentations. What are the pros and cons of poster presentations in general? So at this point, we have written an abstract that is really well written. We've submitted it to the specific conference that we want to submit it towards. We made sure to submit the abstract early. For example, I can only talk about the conferences that I plan to go to, national conferences. I mean, ASA conference occurs in October. They stop accepting abstracts on April 11th. So that kind of gives you an idea of the time frame, where if you're looking to go to a conference in October, 10th month of the year, most of them are going to want it 5 or 6 months ahead of time. So that's just to give you an idea that you're not going to submit an abstract for a conference a month ahead. You know, you're going to submit it about 6 months ahead of time. And that gives everybody involved, the conference presenter, conference administration, the people reading the abstracts and rating them and accepting or declining the abstracts, the people who are going to say yes or no to your abstract, need time to look at all these thousands of abstracts that they get. So this, just to give you a timeline, let's say, you know, it's March, we've submitted an abstract, excuse me, yesterday for a national conference that's happening in September, and it's been accepted. So now we're moving on to the poster presentation phase. This is the point where we're making the poster. So pros of a poster presentation: presenting at a convention or a conference is a great way to network and to market yourself as a match applicant. It is specialty specific, which can demonstrate your expertise, interest, and commitment. It's a favorable addition to your ERAS application. You can easily turn into a case report write-up. You can easily turn a case report write-up into a poster. And there's no lengthy IRB approval. For clinical research or research that involves humans or animals, you have to have International Review Board approval, which is a lengthy process, and it takes a really long time to get done. Next, the cons. The cons of a poster presentation is the turnaround time